In the shadows of American history lurk women who shattered the illusion of innocence, turning trust into terror and care into carnage. Welcome to the 5 most dangerous women serial killers in the USA, where we uncover the chilling tales of 5 female predators whose crimes defied stereotypes and left a trail of devastation. From black widows to killer nurses, these stories reveal the dark side of deception and death. Let's dive in. Genene Jones.
The walker used by Genene Jones Monday was replaced Thursday with a wheelchair. The 67-year-old, while arraigned inside 399th District Court, also wore a surgical mask, though officials refused to say why. The front row filled by family members of babies who would now be in their mid-30s. Their lives, instead, according to prosecutors, ended by a woman who personifies evil.
Born on July 13, 1950, in San Antonio, Texas, Genene Ann Jones grew up in a turbulent household, adopted by a nightclub owner and his wife. The loss of a sibling in her teens fueled her fascination with medicine, dreaming of heroism as a nurse. But beneath her ambition lay a darker impulse. After a brief marriage and 2 children, Genene trained as a licensed vocational nurse, LVN, by 1977, working in San Antonio hospitals. Her brash demeanor, chatty, confident, yet quick to anger, clashed with colleagues, but her skill with patients, especially infants, earned trust. By 1981, she joined the Pediatric Intensive Care Unit, PICU, at Bezar County Medical Center, a fateful step toward infamy. In the Pediatric Intensive Care Unit, Genene thrived in chaos, volunteering for the toughest shifts. But whispers grew. Infants under her care suffered unexplained seizures or cardiac arrests. Between 1981 and 1982, at least 11 babies died in her unit, far above normal rates. Genene was often the first to respond, reviving infants and earning praise as a hero. Suspicion mounted when she was linked to every incident. Her weapon, drugs like Digoxin, a heart medication, or Succinylcholine, a paralytic injected in tiny doses to trigger crises. Symptoms: rapid heart failure, respiratory distress, mimicked natural causes, and Genene's quick interventions deflected blame. She craved the spotlight of saving lives, even if it meant creating the emergencies. Chelsea McClellan, a 15-month-old, became Genene's most infamous victim. On September 17, 1982, Chelsea visited Dr. Kathleen Holland's Kerrville clinic, where Genene had moved after leaving Bezar. During a routine visit, Chelsea seized, her heart stopping. Genene tried to save her, but the toddler died en route to the hospital. An autopsy found traces of Succinylcholine, a drug not prescribed. Dr. Holland, suspicious, alerted authorities. Earlier, at Bezar, infants like Joshua Sawyer, 11 months, and Rolando Santos, 3 weeks, died under Genene's care, with digoxin levels 10 times normal. Parents trusted her. Doctors missed the signs. Estimates suggest up to 60 infants died by her hand, though only 2 were proven due to lost records and lax oversight. Colleagues called her the death nurse. Babies coded on her shifts at an alarming rate. Some nights, multiple deaths. In 1981, Bezar's PICU saw a spike. 42 deaths in a year, compared to 10 to 15 previously. Genene's personnel file noted unprofessional conduct, but no one acted. She kept vials of digoxin and Succinylcholine in her pocket, against protocol, and was seen injecting infants during quiet moments. Her motive, per FBI profiles, was Munchausen syndrome by proxy, a need for attention through medical heroics. Unlike Dorothea Puente's greed or Aileen Wuornos's rage, Genene's crimes were a twisted bid for control, targeting the most vulnerable, infants who couldn't speak. In 1982, Bezar fired Genene for insubordination, not murder, fearing lawsuits. She joined Dr. Holland's clinic, where Chelsea's death triggered scrutiny. By 1983, a grand jury investigated, uncovering a pattern. Infants died or coded only when Genene was on duty. Hospital records, suspiciously incomplete, hid the full toll. On June 22, 1983, police arrested Genene at her San Antonio apartment, finding syringes and drug vials. Parents like Chelsea's mother, Petty McClellan, were devastated, having trusted the nurse who killed their child. Genene Jones, the nurse who vowed to save lives, had become an angel of death. As her trial loomed, Texas grappled with a nightmare, a caregiver who killed in the cradle. The nation demanded answers. How many died, and how was she stopped? In February 1984, Genene Jones faced trial for the murder of 15-month-old Chelsea McClellan. The Kerrville courtroom was electric. Parents wept, nurses testified, and media swarmed. Prosecutors presented damning evidence: Succinylcholine in Chelsea's blood, a rare paralytic not used in her treatment. Genene's defense claimed contamination or medical error, but her history at Bexar County Medical Center told a different story. Witnesses, including Dr. Kathleen Holland, recounted infants coding only on Genene's shifts. Nurse Susanna Maldonado testified seeing Genene inject an infant without orders, followed by a seizure. The prosecution argued Genene induced crises to play hero, driven by a need for attention rooted in Munchausen syndrome by proxy. Genene was convicted on February 15, 1984, for Chelsea's murder, sentenced to 99 years. A second trial in 1985 for injuring Rolando Santos with Digoxin added 60 years, to run concurrently. Prosecutors linked her to at least 11 deaths at Bexar, possibly 60, but lost records and destroyed evidence. Bexar shredded 9,000 files in 1982, limited charges. The hospital settled lawsuits with families for millions, admitting negligence in oversight. Genene, stoic in court, denied everything, claiming she was a scapegoat for medical errors. But her pattern, stockpiling drugs, targeting infants, thriving on chaos, was undeniable. Genene's conviction didn't end the horror. Parents like Petty McClellan campaigned for justice, believing dozens more infants died. In 2017, as Genene neared parole eligibility due to Texas's early release laws, prosecutors reopened cases. In 2018, she pleaded guilty to 5 more attempted murders, receiving life without parole to ensure she'd never walk free. Sent to Huntsville's Lane Murray unit, Genene, now 75, remains a chilling figure. Unlike Nanny Doss's domestic poisonings or Dorothea Puente's greed, Genene's crimes exploited medical trust, killing babies for ego. Genene Jones's legacy is one of betrayal. Her estimated 60 victims, only 2 proven, make her one of America's deadliest serial killers. Her case, spanning 1981 to 1982, exposed hospital vulnerabilities, lax drug controls, ignored warnings, and fear of liability. Her case prompted reforms, tighter drug tracking, mandatory incident reporting, yet the scars remain: parents who lost babies, nurses who trusted her, a system that failed. Genene wasn't just a killer. She was a predator in scrubs, her legacy a warning of trust betrayed in the heart of care. Subscribe to True Crime Drop for more unfiltered true crime drops, and drop a comment on which killer shocked you most. Stay curious, stay safe. Until next time, we've dropped the truth.